This portion of the graph, again, is the spontaneous depolarization, which is representing sodium rushing in through sodium leak channels, which are always open. Therefore, sodium can always leak in, especially after we've pumped it out with the sodium-potassium pump. Now, once we have enough sodium leak in to where we raise our voltage from our resting potential at -60 to -40 and reach threshold, then we have protein channels that are actually voltage-gated calcium channels that open up and allow calcium to rush in. Calcium rushes in, and this portion of our graph is actually called depolarization. Now, once we cross zero, then what that does, it actually triggers the potassium channels to open up, and potassium then leaves the cell and goes outside the cell, and that is responsible for this part of the graph, and that's going to be repolarization. We are repolarizing. We went from negative to positive. Now we're going from positive back down to negative. So we are repolarizing as potassium leaves. Again, we have to actually use our sodium-potassium pumps to pump the sodium that came in out, the potassium that went out back in, and then we also have to use separate pumps called calcium pumps that will actually pump some of the calcium that came in back out. And that restores kind of the original condition so we can keep repeating the process. Okay, now, the signal that we actually talked about that runs from the SA node through the internodal pathways to the AV node, then we have a delay, then the signal goes through the AV bundle, which connects it to the ventricles, and then it goes down the septum through the bundle branches, and then finally up through this area here called Purkinje fibers, and then that, as the signal runs down, it also spreads across to the muscle cells. That signal now actually is what we are measuring when we run an EKG. So an EKG, which is made up of a P, QRS, and T wave, is actually measuring each of these events. So there's actually a program that you're going to be doing that shows how for instance, the P wave is what's called the depolarization, or the movement of the signal from the SA node to the AV node. The QRS wave is actually the depolarization of the signal as it moves from the AV node up through the Purkinje fibers. Now notice that's a big part of the heart. So the QRS wave in an EKG is always the biggest portion of the EKG wave. And then the T wave is actually the repolarization of what's going on here. So bottom line is depolarization triggers contraction, repolarization triggers relaxation. And of course, contracting and relaxing the muscles here is why we even go through this in the first place. Okay, the next thing we want to look at is actually, well, let's actually skip down here and we'll come back to this. The next thing we're going to look at is called the cardiac cycle. Now, I really like the layout of this because it kind of really sums up everything going on in the cardiac cycle in a fairly precise and concentrated bit of information on one slide. Okay, so we could really start anywhere on here, but let's go ahead and go to the start area and let's look at a couple different things. Now, notice we have some terms here: atrial systole, atrial diastole, ventricular systole, ventricular diastole. So the first thing let's do is let's define what we mean by those. So really the easiest way to define this is systole really is referring to what creates contraction. Diastole is what is going on with relaxation. So notice atria, contraction, very short time period, and the red here in the picture is not blood. Blood is shown by the arrows. The red is the contraction of the muscles. Okay, so atrial systole, atrial contraction, only lasts 100 milliseconds. And then the rest of the time, the atria is in a relaxed state. So the rest of the time here, the atria is relaxing, atrial diastole. Now notice ventricular systole, which is a little bit longer period of time. It's 270 milliseconds because we have to subtract 370. We have to subtract 100 from the 370 because it begins at the 100. So it's 270 milliseconds, which is a little longer than the contraction of the atria. We'll talk about why that's important in a minute. But the ventricular systole or ventricular contraction is when we are contracting the ventricles. And of course, we contract anything to squeeze the blood out by contracting the muscles, making the chamber smaller by contracting it. All right, so we have ventricular contraction or ventricular systole here and here. So notice ventricular systole lasts this amount of time, and then the ventricles relax, okay? So here's the ventricles relaxed, here's the ventricles relaxed, here the ventricles are still relaxed, and then we have ventricular systole or contraction again. Now, notice that I never can have the atria contracting at the same time that the ventricles are contracting. So there's no overlap where my atria systole and my ventricular systole or atrial contraction, ventricular contraction are occurring. But I can overlap the relaxation stages. They can both relax at the same time. They just can't both contract at the same time. So that's very important because here's what's actually happening. Now remember, the purpose of the heart is to receive blood and to pump blood. Okay, so here, notice in my relaxation stages is mostly where I'm receiving blood, but in my contraction stages is where I'm pumping blood. Now, let's look at this for a second. And even though our time starts here where we're starting at, atria contracting, let's see what happened before our atria is contracted. And basically what happened was I had blood coming up through my inferior vena cava, blood coming from my superior vena cava, blood coming from my pulmonary veins, and it actually comes in on both sides. And I had my valves open here. So as blood came in, it actually started filling this, and 70% of the blood that came in here passively went through there and started filling up my ventricles, okay? So when I squeeze the blood here in my atria, I'm really only squeezing the last 30% because most of it, as it came in and started filling this up, just automatically also filled up the ventricles because the valve, the atrioventricular tricuspid and bicuspid valves were open. So blood came in and started filling it up. But I needed to squeeze the last 30% in here. Now, once I've squeezed that last 30% that was coming in to my ventricles, so again, the blood is filling up, now what I need to do is start squeezing my ventricles or contracting my ventricles. And when I do that, one of the first things that happen is that squeezing of the blood actually shuts the valve, because the purpose of the valve is to allow one-way movement of blood, but to prevent backflow. So when this was squeezing, one thing we did was we actually sent a message to the papillary muscles, and we had the chordae tendineae attached to them, so it would keep the cusps of the valves from flapping back where they come from. So when we squeeze this and we start squeezing the blood towards this valve and towards this valve, what happens to our atrioventricular valves is the pressure of the blood closes those valves. Okay, now, so that's why we have a difference between what's going on in this step and in this step. In this step, we have closed that valve and we have closed this valve, but we haven't quite squeezed it enough to open up the valve that's going to take it through the pulmonary trunk or take it through the aorta. So the next step, the second phase, whereas we call this the first phase of ventricular systole, the second phase is we continue to squeeze. Notice how our chambers are even smaller as we have contractions. We continue to squeeze the blood up, which keeps these valves shut, but squeezes hard enough to open up these valves so the one-way blood flow now starts going through our blood vessels, our pulmonary trunk, into our pulmonary arteries and our aorta. Okay, so once we have squeezed, and we don't squeeze every drop of blood out of here, but we do squeeze the majority out of here, then, and within that 270 milliseconds of squeezing, then we start relaxing again. Now, whatever blood didn't make it past that valve, and that valve just simply falls back down to the bottom. Notice that at this stage right here, though, because I closed my valves here and here, they are still closed here and here. The blood that got past here, once it got past there and I started relaxing, then it kind of backfilled, but instead of going back down in here or back down in here, what it did is it backfilled enough to close the semilunar valves from the other side. Okay, now at this stage, which is ventricular diastole or ventricular relaxation, the early stages, nothing's contracting, but all my valves are closed. Now notice there's out of these 1, 2, 3, 4, 5 pictures, there are 2 pictures where all the valves are closed. This picture, where I've shut those valves, but I haven't opened these valves, all the valves are closed here. And this picture where I haven't, these are still shut, and actually once I started relaxing and the blood kind of started to try to backfill, it actually closed the semilunar valves from the other side. Okay, now, as my relaxation continues, remember, I'm still going to have blood coming in through my superior and inferior vena cava and from my pulmonary veins. As that blood starts coming in here, it builds up enough pressure to open up this valve. Notice how it's open now, and open up this valve. Notice how it's open now. Again, everything's relaxed, but blood is still continuing to come in. So that pressure of the blood opens up those valves, and then it starts passively filling up the ventricles again, even before any contractions take place. So I am passively filling my ventricles. About 70% of the blood that's going to go in my ventricles comes in this method, but then I go ahead and my atria contract again, squeezing that last 30% down into my ventricles before my ventricles contract, close off my valves, and eventually open up the valves where they squeeze the blood out. And so what I want you to do is read through these steps, understanding systole means contraction and diastole means relaxation. Look at the steps, look at the pictures, look at the time, and again, the whole event is called the cardiac cycle. So I want you to make sure that you understand all of these events. And because on your test, I'll probably have you understand the definition compared to what's going on in the picture.